Welcome back and welcome to our Community Corner. Today is Thursday, so we have our Medical Minute interview. And joining us this morning is Dr. Udit Verma with OSF Healthcare, here to talk about National Flu Vaccine Awareness Week. Thank you so much, Dr. Verma, for coming in.
Glad to be here.
Of course. So let's talk about National Flu Vaccine Awareness Week. Why is this week so important for us to observe?
Yes, thanks. Important question. National Flu Vaccine Awareness Week is being celebrated from December 5th to 9th this week. It's basically an annual observance every December in which the stress is to get your flu vaccine and tell everybody it's not too late yet to receive your flu vaccine. It's a potentially serious condition, and the best bet against prevention is the vaccine.
Right, absolutely. And I know you said it's not too late to get the vaccine. Is it ever too late to get the vaccine?
Again, no, it is not too late. Usually the vaccine works best if you get it by October. Having said that, if you still have not received your vaccine yet, it is time to call your primary care doctor's office and get the vaccine. The vaccine gives you a good protection against the flu, which usually needs time to develop. So if you get it by October, you are good when the peak flu season strikes around February. If you have still not received your vaccine, some degree of protection by vaccine is better than no protection at all.
Right.
So I would still stress, yes, please go ahead and get your vaccine. Very
nice. And how is flu season shaping up so far this year?
We have some early information from CDC. According to them, since about till November of this year, we almost have 10 million cases of flu, out of which there are 100,000 hospitalization, and unfortunately 9,000 deaths have already been reported. The concerning scenario, Aaron, here is we still have yet to see the peak of flu season, and if we do not safeguard ourselves with prevention like vaccination, we can very well understand the burden of this illness on our resources, on our population health.
Wow, yeah. And the flu vaccine, is it just one dose, or is it multiple doses like the COVID vaccine?
Again, very good question. Flu vaccine is one dose vaccine. Every year we need a new flu vaccine as the virus changes slightly, so a new vaccine is needed. And we also have to remember one vaccine will not give you everlasting protection, as immunity does tend to slow down a little bit over the next few months. So every year we need a new vaccine. And one vaccine is good enough.
That's good. And what is your message to any viewers who may be hesitant about getting the flu vaccine?
Good. There are certain important bullets I would like to highlight. As I just said, this vaccine is important to safeguard ourselves and our loved ones against this serious virus, which can cause pneumonia and risk of hospitalization or even death in certain vulnerable population like infants, elderly, adults with certain medical conditions like diabetes, COPD. If you're pregnant, you should get your vaccine to save yourself and your baby against this serious virus. And this virus is, this vaccine is prepared from a killed virus, so this vaccine will not give you flu. And if you are going to your doctor's office for your COVID-19 vaccine, you can very well get the flu vaccine at the same visit.
Oh, okay.
And the best, of course, we always continue to follow our hand hygiene measures. If we are sick, we should continue to follow self-isolation and quarantine.
Very nice. Lots of good tips there. Thank you so much, Dr. Verma, for coming in and informing us about National Flu Vaccine Awareness Week.
My pleasure. Glad to be here, Aaron.
Of course. Thank you so much. And of course, if you or someone you know would like to join our Community Corner, you can head to our website, 25newsnow.com, and click on the Community Corner tab. You'll find a form there. Go ahead and click it out. We'll take a look, and we hope to have you on very soon. Stay with us. We'll be right back with more good news and weather.